But moving on to the Upper West region, that region has recorded its first case of COVID-19. The patient is a 42-year-old who traveled to Spain and the United Kingdom and had come into the country through Egypt. He boarded public transport to the Upper West region 8 days ago and subsequently stated to have the symptoms or found to have the symptoms of the virus. Upper West Regional Minister Dr. Hafiz bin Salih, who disclosed it to the media, said the patient is on self-quarantine.
He took over as Upper West Regional Minister. Never has he held a press conference in such a hurried manner. Though Dr. Hafiz bin Salih is a politician who loves the optics, but not at this material moment to speak about the virginity of his region broken on the COVID-19 pandemic.
We are assembled here to announce that the virginity of the Upper West with regard to the prevalence of COVID-19 has been broken. We now have a patient in the Upper West region. But the good thing is that even before the test result came out positive, the suspect was in self-quarantine.
The Upper West region is the third region after the Greater Accra and Asante regions to record a case of the deadly disease. Dr. Bin Salih said the patient had a sojourn in a couple of countries where the disease is prevalent before returning to Ghana and the region 8 days ago.
A 42-year Ghanaian who visited UK and Spain and returned to Ghana 8 days ago through Egypt and traveled from Accra to through public transport has been confirmed COVID-19 positive. This is the first case of a suspect whose samples were taken for tests, and the result is that the patient is a COVID-19 patient.
Dr. Bin Salih said government is not leaving any stone unturned in its quest to fight the invisible enemy. However, government needs the support of all and sundry to fight the disease which is on the verge of tearing the country's economy, society, and itself apart. He appealed to well-meaning sons and daughters of the Upper West region to come to the aid of the region.
There are a lot of things that we need. They could buy hand sanitizers so that we supply or distribute to people. They could purchase Veronica buckets, donate to us, and we'll distribute to people in the region. There are so many things that we need. If you have the capacity but don't know what to purchase, you can contact the Regional Director, Ghana Health Service. He will provide you with the necessary guide so that whatever is purchased would be of use to us in the region.
Upper West Regional Director of Health Services, Dr. Osekufo Afre, spoke of elaborate plans of tracing all persons that the patient came into contact with.
And he came using the public transport. And it's been very, very difficult to get the people who he came with in the bus to the place. He disclosed the kind of public transport to us, but for the purpose of anonymity, we can't disclose it. But from here, we'll be going to the bus terminal to be able to see how much information we can retrieve that can be linked to people who may have come into contact with this individual.